It's in the environments that we live in. When we go to work, when we could take our kids to school, when we're going grocery shopping, health is in everything that we do.
For more than 16 years, Community Health Improvement Partners, CHIP, creates communities where everyone can achieve optimal health. By recognizing the greater needs of the community and taking action through effective collaboration, CHIP is a unique model that works.
We've done a lot of research looking at other models across the country, and we haven't found one like CHIP. We have so many different types of organizations that we work with. We tackle multiple issues in the community, working throughout all the regions of San Diego County.
CHIP brings key stakeholders to the table to address problems and identify solutions.
It's the community telling us what they need and what their health issues are so that we can provide information back to them about what needs to be addressed.
Needs assessment is at the core of CHIP's collaborative model. Charting the Course 6 is the result of 18 months working together with community leaders to identify the most critical health issues in San Diego.
I was fortunate enough before I came to CHIP to work on the needs assessment as an epidemiologist for the county. And if you don't love data like I do, then the Charting the Course needs assessment provides information back to the community in a way that everybody can understand it.
Charting the Course 6 identified 5 priority health issues: obesity, access to health services, social determinants of health, mental health, and injury and violence.
The Community Health Improvement Partners Needs Assessment is a roadmap to identify what the priority health issues are for San Diego County. Once these are identified, we engage our community partners who are truly the best and the brightest in public health in San Diego County. We bring them together to solve these health problems.
CHIP doesn't just identify needs, CHIP develops programs and initiatives to tackle the biggest community health problems. Today, CHIP is working with more than 200 partners on 20 programs and projects.
We've come to be recognized as leaders and coordinators of obesity prevention partnerships throughout San Diego County.
America's finest city is unfortunately not the fittest city. San Diego's families need a supportive environment that makes the healthy choice the easy choice. CHIP is here to help.
We're working to create real opportunities in all neighborhoods for people to access healthy foods. Ideas like community gardens, urban agriculture, bringing locally grown foods to schools, healthcare institutions, and other places where we spend our day-to-day lives.
CHIP's Resident Leadership Academy empowers community members to get involved and create change. The RLA is a 10-week curriculum which teaches community health organizing techniques. With an emphasis on food, physical activity, and public safety, residents in underserved communities gain the tools to improve their quality of life.
We're really kind of blazing a new trail and showing the field, how we can implement real projects that reduce health disparities and inequities through community involvement. And it's the authentic community involvement which will ultimately make the difference.
I have learned the importance of working with the community, working together, how we can't really do a change when it's only one person. But when there's a lot of people getting together with one common cause, we can actually make a change.
For many years, CHIP has worked behind the scenes, bringing partners together to address the mental health needs of the community. Suicide is an issue that can't be ignored. CHIP has completed the facilitation of a year-long process to develop recommendations on how to prevent suicide in San Diego County.
Suicide is not an individual issue. This is a community issue. It's a public health problem. So we have to work together to address the problem of suicide.
CHIP formed the Suicide Prevention Council, a collaborative effort of more than 75 organizations and individuals throughout the county.
By continuing to work together through the Suicide Prevention Council, we have a work plan created that will guide our efforts for the next 3 years.
CHIP works across the full spectrum of engagement, from grassroots to treetops, solving community problems.
What I love about CHIP is that we think big and act boldly. And we're very lucky that we have a lot of partners around the table that are like-minded. And I think because of that, the future looks bright for CHIP.
As innovators and leaders, Community Health Improvement Partners continue to produce positive change toward a healthier future for San Diego County.
I have lived in San Diego with my family for 22 years. I've been in the healthcare arena for over 30, and I am so proud of the work that we do in this community through collaboration. It is a group of committed individuals that makes all this possible. So to all of our partners, thank you.